It's Wednesday night, and we're live from Oakdale, Washington, in the Educated Touch studio. Welcome to Ethics Outside the Box, with your host, Nathan Nordstrom. Special guests include
Miss Lena Gupta.
And you. Here he is, Nathan Nordstrom.
Welcome, everyone. It's great to have you with us this evening. Tonight, we actually have some, what I think of as a very exciting topic. I think each week it's very exciting, but some are a little drier than others. And so I want to always make sure that when we find a topic that many people can talk about and can connect with, as you guys are on Facebook and in groups and that kind of stuff, please feel free to drop in and connect with the concepts, and we'll kind of go that direction and work off your questions as much as we can. Because this week we've got two major wonderful things. First thing, we have Ms. Lena Gupta, who is one of my I don't know how to define you, Lena, because I think of you as my good friend, and then I think of you as my mentor in cases. I think of you as a motivator, an inspirational person. I think of you as a massage therapist, amazing leader, and then I kind of go, but she's really just my pal, and well-dressed. So all of those things put together, that's where we define what Lena Gupta is. Lena, thank you so much for joining me today with this call.
Thank you for the invitation, Nate. It's very exciting to be here and to be able to discuss ethics in an engaging way.
Yeah, well, we try for engaging. That's kind of the whole purpose and the whole point. And being able to connect social media-wise and being able to connect with people around the nation in a way about things that are really addressed on a daily basis in massage therapy practices, but aren't really dealt with in a day-to-day basis in a way that they could be for building strength. That's one of those things that I really wanted to do, and that's why I kind of put this class together. We're just over halfway through. We've got the rest of the year to go. We've got 52 hours of ethics that we're going to be doing this year. It's been fun so far, and there's been weeks that I've really felt like I just wish I could redo that week again, just because it was so engaging and so connected. I'm hoping that we can do things well. I know, Lena, you've got things coming up this next week. You're going to be teaching at the World Massage Festival. What else are you doing? How's your practice going? What are you doing for teaching? Where are you at? And all that other good stuff.
Well, after many years of living in Pennsylvania, I moved to California, and that in itself has been quite an education, considering I'm very used to living in the rain of London, the wind of Chicago, and the snow of Pennsylvania. So embracing the California culture, but the real driving force behind that move was to realize one of my dreams in terms of program development in integrative medicine. So I'm now going to be focusing on developing degree programs for healthcare professionals, undergraduate, graduate, and at the doctoral level.
Wonderful. And you're currently at, is it Pacific University?
It's Pacific College of Oriental Medicine. That's actually a massage therapy and acupuncture school with associates in massage therapy and a master's in acupuncture and doctor of acupuncture. But with the things that I will be developing over the next year or two, will expand much more into the vision and mission of integrative medicine, from massage therapists and nurses to a multitude of healthcare professionals advancing their skills to work together.
Awesome. I love to see that. That is one thing that several weeks ago we were talking about, being able to appropriately refer and connect with other medical professionals, and our ethical standard and our standards of practice that we need to be really connected with the rest of the medical field. It is so nice to see programs that connect all of the healthcare genre together. So thank you for doing it, and thank you for being being a pusher in the massage therapy industry to kind of really develop what massage therapy can be. And
just another little note on that, like you know very well, and so do many other nationally board certified massage therapists, that they get 30 credits towards the Siena University bachelor's degree. And once they do that, they're then eligible. They would become eligible for one of the degrees that I'll be developing, a master's in peak performance, which will be nutrition, sports, health coaching, something very aligned with sort of our hearts as a massage therapist.
That's awesome. So you're connecting with the other college so that you can connect and really draw education up. I'm just excited to see that, because we get these little steps as we go, and a lot of massage therapists don't realize what it took to get some of those programs in line, and it's truly life force that gets pushed further and further to really draw people up. So thank you for being there, and yeah, it's great for those massage therapists who got out of their massage therapy program and said, I want to get more education. Take those next steps. You become a better therapist because you're connecting and communicating. So thank you so much, Alina. Let's do what I always do each week, and we're going to switch over to the wonderful place that we always want to remind people to go, and that is the National Certification Board of Therapeutic Massage and Body Workers website. That is www.ncbtmb.org. And we are going to the Standards of Practice page. So if you go to the ncbtmb.org and scroll all the way to the bottom, you'll find About Us. And you'll find not only the About Us things, but you'll look at the Code of Ethics and the Standard of Practice. So we've clicked on the Standard of Practice page, and we've gone all the way through Standard 1, and we are now into Standard 2. And last week, I had a really fun week in presenting, and we talked about obey all local laws and local, state, and federal laws. And as we started introducing, hey, next week we're going to be talking about accepting responsibility for his or her own actions, Jane was like, wow, that's going to be a fun conversation. And I'm like, yeah, there's a lot to that. And then I started reading the second one, and I flubbed it up completely. And so we're really going to talk about these two a little more in depth so that we can make sure that I got it right. Apologize for the end. I actually put little notes on here that says, don't obey what I'm saying, just read what it says. So C is accept responsibility for his or her own actions. And standard D is report to the proper massage therapy regulatory body within 30 days of discovering of any evidence, such as firsthand knowledge, indicating any unethical, incompetent, or illegal act committed by other certificants. So yeah, we'll get there, but I think C has a huge amount of power to it. So responsibility for his or her own actions. Right now, we have this unique aspect in our massage therapy, in our world. We can pull out of the massage therapy profession and just talk about the world as a whole and say, accepting responsibility for his or her own actions can be a challenge for a lot of people when there's not a responsibility put on them. And so how as a mother, because I know you're a mother and I'm a father, and we've got kids that we've had to deal with some of these responsibilities, how did you go about making sure that your children were responsibility for their actions?
Nathan, I believe I'm still working on that, not only with my children, but also with my grandchildren. So you gave me such an incredible introduction, but I just want to bring it down more to ground level, that no matter how many years we're doing a job, a role, or practicing, and I've practiced for over 25 years, I've seen over 10,000 people, but every human interaction, this is what my mother used to say, every human interaction is an opportunity for learning. So no matter how much experience we have, because we're all individuals, in a way, every new client is a whole new experience and a whole new responsibility.
Absolutely. And what works for one person doesn't always work for another.
And I think one of our challenges as practitioners is that even though there are opportunities at spas and corporate opportunities, hospitals are moving in the direction of integrative medicine. Cancer Treatment Centers of America is an outstanding example of how they've embraced massage therapy, and they've expanded from 1 hospital to 5 over the last few years. Essentially, many of us still practice alone in our room. We are still very much an isolated profession, not exactly by choice, but by nature. So when we talk about accepting responsibility, it's because we're more isolated and we don't have these opportunities unless we go to a conference or log on to a webinar, take a course to really dialogue with our fellow professionals. We can almost lose sight of defining what are those responsibilities that we have each and every minute that we're with our client and each and every minute that we're not with them as well.
I love a couple of different aspects of massage therapy. One thing that I regularly push people to think about is that a profession doesn't really become a profession because of the number of employees in the profession. Most of the time it's because of the volunteers, the leaders, and the people who want to see an improvement in that profession. And that's what really develops and creates strides into the profession. When I'm looking at the massage therapy industry, we have people who have taken responsibility for their own actions and stepped out of their comfort zone and really created something quite amazing. That could be that they started up a group, they started up one of the acronyms. It could be that they took, I just call them acronyms. So they took something in one of those groups and said, hey, you know what, we can do this better. And they've stepped into a slight bit of discomfort so that they could make something that really develops to what tomorrow will be something that is standard practice. And that's where I say responsibility for his or her own actions as a leader in the profession. We have to hold true to it. But then every time you go into your treatment room, every client who walks in, as a massage therapist, you're touching them and connecting with them and having a responsibility to aid them in their health. Not that you're going to fix them, not that you're going to do any of that, but you're aiding them in their health. And being able to be true to that responsibility, that if you walk in and you say, okay, I am going to do my best to help you and assist you so that you can feel better, and then it doesn't happen. I can tell on myself in several cases of things that I've done, and I've had to stand up and take responsibility for them. I had a client who had lower back pain, and I went through and I did a lot of QL work, and I did glute work, and I did their whole back, and got lats and all that relaxed, and said, okay, now let's have you turn over. And the client couldn't turn over because we relaxed the wrong muscles. Instead of focusing on the muscles that were problematic and creating some space in there, I had completely done the opposite thing and created more problems and more trauma. That hurts when you do that, because no massage therapist wants to have their client say, oh, I hurt worse from my massage. But being able to step up and say, you know what, I am so sorry. Let's work on making you better, or let's refer you out to the right place. I really do love, early on in my career, I worked with a chiropractor, and I had one client who went upstairs, and the massage therapist we were in the basement, and was upstairs, got a chiropractic adjustment, and the chiropractor couldn't get something to go. And so she said, oh, go get the massage, and then I'll come you'll come back in and I'll adjust the joint after you get the muscles all relaxed. And so got her all relaxed, and she couldn't get off the table as well. And so I went upstairs and got the chiropractor. Chiropractor was able to come downstairs, do the adjustment on my table in the center, and then the person could get up. I had relaxed so that the joints that were locked out were still locked out and weren't allowing movement. These are pieces where it's not intentional. You're not striving to create a problem, but being responsible for your actions and for the things that you did is important. Standing up instead of, the opposite, which once again, I have wonderful children who I love dearly. And sometimes they use the E word, and that's making excuses. And instead of honing to it and saying, yep, I did that, and I'm sorry that that's the response, and here's what I'm going to do not to have that happen again, they go, but Tom was doing it, or, but I didn't want to. Oh, that one drives me nuts. That's one that, yeah, I didn't want to. That's not an excuse, and that's not holding responsible for your behavior. Responsibility is huge in our profession as well as in our world, because what happens when someone doesn't take responsibility for their actions?
Well, there can be any number of ramifications, but one of the things, as you were speaking, I was thinking of was that it's just as important for us when we do our assessment to know what to do as it is to know when not to do. And I think sometimes we are not so invested in identifying when not to treat, when not to use a certain technique, and really thinking about if a person is in whether acute or chronic pain, there's a certain level of compensation. They may be able to be upright because their quadratus lumborum is tight, or because the psoas is contracted, that's allowing them to be stable. And if we use all these wonderful techniques that we see in CEU classes across the nation, we can easily immobilize the person, because now the very thing that was compensating, and as human beings, we're compensating all the time, whether mentally or physically, we're adapting to our surroundings. We have all our systems trying to achieve some level of homeostasis. And then if we go in and we think we're doing something really great because, oh, this muscle is really tight, let's stretch it, let's do muscle energy, let's do neuromuscular, trigger point, all these techniques, and, we could have an adverse event.
Yep.
So I think proceeding with caution, we have a responsibility with our clients. As much as we all love going to hands-on classes, and like you, I know many massage therapists who do far more continuing education hours in a year than we're required to by our licenses, we have to sort of pull back and take the responsibility to assess appropriately and really live our scope of practice. Because like you, many of us who have been national volunteers have fought the good fight for licensing in our states, and that's fantastic. It's allowed us to move forward as a profession to be more respected. But at the same time, I don't know that we spend enough time refreshing ourselves with what is really our scope of practice, and not enough dialogue like this, that what is our responsibility. And it starts from that very first moment of meeting the client and then finding out what are their needs, what are their goals, what are their visions, what are their dreams, and being honest with ourselves. Are we the person who can facilitate that for them? Or are we part of a larger system which might involve referral or co-management of that particular case?
Yep. Yeah, I love that you can only know so much, but your true strength comes in knowing what you don't know.
And it's a tricky one, isn't it? Knowing what you don't know, because we actually don't know what we don't know, which is such a conundrum.
But we can say, you know what? I have no clue how to deal with that. And so let me make sure to refer that out to a place that would know more than I do, because I've got no clue. And it's really nice to be able to have that ability. I don't think they teach that in any specific continuing education class. Welcome to whoever wants to write that class. That's a freebie. Please take it and write something qualified and great with it, because we have to be able to say, gosh, massage is a great tool, but sometimes it's not the right tool for this situation. And sometimes I don't know. Colette Wilson, do you know Colette? Do you remember Colette?
Yes, of course.
Colette's wonderful. She messaged me and she reminded me of this a few minutes ago. But she messaged me and said, "Hey Nathan, would you work on someone who has a broken sternum?" And then she went back, and as we talked, she presented that the broken sternum, she is doing online registration for her office. And so a person will type in their health history and all that stuff online, and it'll pop up on her schedule as an appointment. And so she got this new appointment, and she looked through the health history and said a broken sternum as of a week ago and all this stuff. And she went through it, and she's like, would Nathan be comfortable doing this? Would Nathan be comfortable working on this person? And so I responded, and I'm like, well, are you comfortable? And she says, thank you for that, because she realized in her own mind, it doesn't matter if Nathan's comfortable working on her. It's would she be comfortable working on this person, no matter what someone else's knowledge is. And I think that's where our strengths, once again, come from, is knowing that no matter what someone else can or cannot do, if they're going to be safe, if they're going to have, is their liability coverage versus my liability coverage, am I going to be safe in working with that person? Am I going to have the best skills? And am I going to be able to refer out? FYI, she referred out, and she said, no, I need a doctor's note, and it seems like you probably need to have that healed a bit before I would be able to work on you. It's one of those things, because I do know a lot of massage therapists who would be very effective at working on something with the rest of the musculature, obviously not going in and working on the sternum to see if they can heal the broken bone, but being able to work on the rest of the stabilizing muscles to reduce the pain. You know, we have a lot of things that happen, and I don't doubt we've all seen that client that we're a little scared of. Not that we're scared of the client, but we're scared of their condition. And so being able to be responsible, and then also holding the client responsible, because there's a responsibility there as well. I've had clients who have lied to me about their health, about their condition, and just not told me that they were currently suffering from this or suffering from that. And so when you start working on them, I think one of my favorite stories was a client who came in, hadn't seen him for several months in the spa I was at, and he came in, and I asked him if there was any updates to his health history, if he's suffering from anything, seen a doctor. He's like, no, I just need my back worked on. And I started working on his back, and he had these really bizarre knots in his back. And I was working on it and couldn't quite get it really to relax out. And he says, hey, can we roll over? And I'm like, oh, okay, it's a little early, but not a problem. Let's have you roll on over. As he rolled over, he had a quadruple bypass, and so he had wires that were holding his sternum together. And of course the stitches and all. And I'm like, wait a second, when did that happen? He's like, oh, that just happened a couple of weeks ago. And I'm like, but why didn't you tell me about that? That's part of this health history thing. And so I told him I had to stop because of the circulatory response. And in my own personal case, that was my understanding for safety is, no, we can't be working on that condition at that point without a doctor's recommendation and. However, I told him, if you would have told me, then I would have been able to give you the best heads up and given you the direction that you need to go so that we can be most successful as a pair working on your conditions. So not only being responsible, holding people to responsibility, and the third one, there we go, is kindly. We can do things with a smile, or we can do things in frustration, irritation. If we're doing it in frustration and irritation, we're not improving ourselves, nor are we helping them. It's just an emotional outreach. And so being able to filter through yourself and filter, how would I like to be talked to? How would I like to be communicated to? That's part of your responsibilities, and being responsible for our actions. Not everyone grows up at the same speed. So that's one that I always like to connect with, that being able to become mature in our abilities to communicate is something that I think will make us all stronger as a profession, but it makes us stronger as people as well.
I think communication is a very huge topic, Nathan, that we can approach in many ways. And one of the things that came to mind as you were speaking was about us being authentic in our communication. And that if we listen to our inner selves or our instinct in terms of the comfort level, how do we react when the client tells us about their health history? Sometimes people forget it's not so much they're withholding a triple bypass or a quadruple bypass or aortic aneurysm or DVT. It might be that either it was so long ago or it was traumatic and they pushed it to the back of their mind. Some people are very focused on the injury they have today. Maybe it's neck pain or headaches, and they might think, oh, well, the fact they had several falls doesn't relate, so they don't necessarily check the box on the intake sheet or verbalize it. So we know that we could have a client that has a history, if not even a contraindication, that they might not have declared. Well, and then I think if we assess, which we do, we are so good at palpating as a profession that if we trust that, assessment, and even if we are at the stage, the person is on the table, they are undressed, but before proceeding, we get a sense that we're not sure if this treatment or technique or approach is right for them, then it's best to terminate the session, explain it to them authentically, and refer them. And I've had this experience. I had this experience when I was in Chicago, where I had to tell a fellow, I'm sorry, I don't think I'm the right one for you at this time, and never proceeded with the treatment. I gave him some options of people I thought he could help. He didn't come back as a client to me, but what he did do over the next year is he actually sent 5 people to come and see me, some family members, some neighbors, because he actually was impressed with the level of ethics that we went to a certain point in the treatment. I didn't feel comfortable to proceed. I didn't charge him for the time. He went away, he got help, and I got 5 new clients in the year. So I remember him often because it's just sometimes as practitioners, we can have fear of losing a client. Some people keep people coming back. Maybe they're not taking the right responsibility there or taking too much responsibility. Maintenance treatment is always very good. I'm an advocate, but of course, massage therapists have to put food on the table, and we are dependent on the number of clients we see every week. So there can be a dilemma, an ethical dilemma there between a person who, most clients look up to their massage therapist. That person is on a pedestal in their life, makes them feel fantastic. So it raises another communication question that what does the client actually want? Do they want to come in monthly for maintenance treatment? Are they happy to come in weekly? Would they rather come once every 3 months? So another aspect of communication and and honesty and authenticity in the therapeutic relationship.
I love I love when a client comes in and they have that challenge, and you get to a point where you're like, wait a second, something's wrong. And they're like, oh, I just thought it was okay because it's just a massage. I didn't think it was going to affect my circulatory system, or I didn't think it was going to affect my headaches, or I didn't think it was going to affect this or that. I just wanted to get a massage. And that's, I think, where part of our training and our education to our clients really comes in, is being able to express to them the importance of what we do and how it can affect them, and how the behaviors that we have will draw to the foreground, and really being responsible for the way we work, the way we communicate, the way we share. Because you're right, it is that piece. I had a client who came in and had all of the signs of a blood clot behind the knee, and the tightness, and it wouldn't contract. And I said, I am so sorry. I'm going to have to refer you out. I would suggest that you go to your doctor quickly, because this is not something to mess around with. If your doctor checks it out and says it's nothing, then I am absolutely great with you coming back. But this is one of those things. And she was a healthy individual. She wasn't obese. She was very exercise and nutrition focused, and she never came back. However, because I was in a group practice with other massage therapists, she continued coming to our facility, and I checked in on her and checked her notes and looked, and she was fine. And I'm like, oh, I am great with that. I am absolutely okay with her not coming back and seeing me. And I'm absolutely okay with her going and getting checked out, because all the signs and symptoms were enough for me to say, I can't continue personally. And that, it may not have saved her life, but because I did it, I'm more likely to do it next time. When I was in massage, when I was a massage clinic instructor, one of my favorite things to do, I love doing this, and it's the meanest thing I can do, is having a student who's coming across someone who they have to deny. Because if they can do it when they're not getting paid, when they're a student in massage school, once they're out in practice, it's more likely that they're going to then say, I've done this before, I know how to do it, I know why to do it, I know I need to do it. And even though I'm not going to get the 60, 40, 30, whatever bucks that I would be getting from this session, it's the right thing to do, and so I need to follow through with it.
Yeah, and I think we have, you were talking about essentially educating the client. I think that's a huge responsibility that we all have, not only to educate the client, but to educate the public at large, bringing back, the ambassadorship. Each and every one of us have a responsibility to be an ambassador for our profession, and that's how we will collectively move forward. You were talking about volunteerism and how emerging professions become established, and massage therapy is just one of many that has been through the growing pains of becoming licensed, becoming well respected by other healthcare professionals. Still, we have a great deal of work to do to educate the public in the value of massage therapy, and that massage therapy is not just for relaxation, but is part of their daily health and wellness lifestyle.
I love that it was 41 minutes through until I heard you say the word ambassador. So
I don't think there's a day that goes by that I do not say the word ambassadorship, because I say in classes that I teach 3 or 4 times a week. Even in my biophysics class, somehow I get the connection with ambassadorship to bridge gaps. And I just, as you know, and anybody watching who knows me, I just feel that this is our number one responsibility, that if we take responsibility to be ambassadors, each and every one of us, not waiting for someone else to step up and push the boundaries, then our collective force of over 100,000 people just devoting maybe 1 hour a week or 1 hour a month to doing that will elevate us and be a catalyst to our greater recognition, which serves the greater good, not only of the profession of massage therapy, but a direct impact on the society at large.
And I love time frame. When you have 300,000 people doing something for 10 minutes, that makes a huge difference. If you have 100 people spending a couple of hours, that makes a big difference still. But when you have one person who does something for 24 hours, it burns them out. And so being able to be a true ambassador for massage therapy, not only to the doctors that you're dealing with in the community, but going in, I had a friend when I came out of school who interoral was all the thing that's all she wanted to do, was just work on the jaw and the stabilization of the jaw. And so went out and talked to orthodontists and dentists and went through the local area and just got her business card out there. And because she did that, she made the connections that she needed. She connected with a profession, and she pushed forward the concept of massage therapists being able to do interoral work. It became a big thing in her local community that everyone was like, no, after you go to the dentist, you should go and get a massage, because these are going to be the problems that can have. Anybody's got clicking, it was all marked because she decided to act as an ambassador to the oral health industry for massage therapy. And yes, she's just one person, but aren't we all just one person? And if
we're all one person, but we can have the impact of many if we gather together as a force with our collective momentum. And you remind me, I teach a course called Applications of Interprofessional Communication. And it essentially pushes people out of their comfort zone. They have to find a health professional, not of their profession, and they have to spend 30 hours observing that person. This has only been the second term. It's a work in progress. But the results have been phenomenal because these practitioners have observed a dentist, a veterinarian, an orthopedic surgeon, a fertility clinic, and have made connections with other healthcare professionals they otherwise wouldn't. They have either been employed by the person, or they're getting referrals, or they're simply understanding what another healthcare professional does. What is a day in the life of an orthopedic surgeon or a veterinarian who does acupuncture or body work? And it has actually been quite illuminating to me too. Even being well versed with many of the healthcare professions, I've learned through these students, about 150 of them or so, that they come back and they discuss their experience. So just that one connection that they're making is directly positively impacting their business.
What a way to start thinking outside of the box. And that's how we come up with some of the most ingenious things in our community and our culture, is by introducing ourselves to something that isn't normal to us, and really start figuring out and engaging in many ways. I know I worked at University of Western States in Portland, and one of the things that I absolutely loved was I was one of the very few non-chiropractors on staff. And so being able to address chiropractors and work with chiropractors and sit in classes with chiropractors and learn chiropractic ideas and concepts, and then draw them to the massage therapy industry and saying, okay, we can't do this, we can't do that. What are the boundaries and what are the safety mechanisms that are in place for a massage therapist so that they're not doing chiropractic? And so I wrote a CE curriculum years ago on that, on making sure the massage therapist who's really doing deep structural work is safe and professional. Those are those things where you get out of your own comfort zone and start pulling to other things. It only makes you better. I agree. I want to take your class now.
So they have to write a paper about both the practitioner as well as the patients that that practitioner has seen. But you did raise a very important point on safety. We didn't really discuss the responsibility of safety, which probably trumps everything else, because ultimately we want to serve the public trust by being safe. And it kind of leads us into this second aspect about, unfortunately, reporting to the proper regulatory body within 30 days discovery of any evidence, such as first-hand knowledge indicating any unethical, incompetent, or illegal act committed by other certificants, which actually features in this class, in that, when does that point come? When is it that you're working with a colleague who's just having a bad day and has done something, or you see a repeated behavior that's either inappropriate and unethical, and what action do you take?
There's a couple of different pieces on this that really kind of spur me in different ways. The first one is actually the very last two words, by other certificants. And that first piece, to me, I'm going to think outside of the box here, since we were already talking about thinking outside of the box. Other certificants. It doesn't say certificants from the National Certification Board of Therapeutic Massage and Body Workers. It says other certificants. So this feasibly could be anybody who is a professional in anything that's holding to a standard and is not following through to it. So it's ambiguous enough to say, if you're going to, I will put once again myself in this hotspot. My wife and I, between our second and our third child, had a miscarriage, and in that process, the doctor, the new doctor that my wife had gone to start talking to, he demonstrated incompetence in his ability to communicate and be professional and demonstrate the best practices in working with a patient, that it shocked both of us. And so as we were sitting there thinking about the process, and as we were going through the emotions of the miscarriage, once we had gone through the emotions and gone through our own personal counseling with each other, I still had something in my gut that said, this guy needs to be reported. Not that I wanted him to get in trouble, not that I wanted him to have some problems, not that I didn't like him and I thought he was going to be cursed and he's the worst person in the world. Just that the behavior that he demonstrated, that incompetence, I don't want anyone else to have to go through that. And so my responsibility to professionalism as a whole, not just to the NCB, but to professionalism as a whole, means that I felt responsible, that I needed to report it to the appropriate bodies. I can say it was more than 30 days after the events and all that, but I felt like I had to follow through. And so I followed through and presented the information to the licensing board, to the medical board in the state of Oregon, where I was at. But that goes right to the beginning, which is the other half that I have the conscious piece to, is that it's our job to really send the information. Proper massage therapist regulatory board within 30 days of discovery of. Okay, so our job is to disclose it, not to dig up information, not to go snooping around, not to try and find their documents or even call them up and try and make an appointment with someone who's not licensed, or trying to do. We're not here to be snoops. We're here to give results of any first-hand knowledge incident of unethical, incompetent, or illegal activity. So how often do we come across or get that opportunity to be first-hand knowledge of illegal or inappropriate activity? Lena, have you had a lot of experience with firsthand knowledge of inappropriate or illegal activity?
Well, I really appreciate, Nathan, that you shared your very personal story about the miscarriage, and that's a very charged situation. There's no doubt about it. And it did remind me that my mother lost a child in the 60s. And being new to England, she certainly didn't, neither of my parents really, I guess, thought about taking any action or reporting what actually happened, but it was a really outstanding example of incompetence. The child could have been saved and would have been my brother today.
Yep.
So, I also have very deep feelings about this and think that it almost goes to our first topic of responsibility, that we have to look at this responsibility as in serving an enormous number of people, because it's not about us and our clients. It's about every person who interacts with that practitioner and how, whatever their field may be, and what action that person may take. Sometimes you develop friendships, as we have with colleagues that you've known for many, many years. But what trumps that is, what harm could that person do, whether mentally, psychologically, physically, spiritually, that we may never know. And that kind of, I feel, puts it more in context about taking the responsibility to report unethical, inappropriate, or incompetent behavior. Because essentially, as massage therapists and holistic practitioners, we often come into the field feeling we can heal the world. I mean, I always ask first, in the first class, when I used to teach AP1, it was the first term of the massage therapy program, and as a class I love to teach, have taught it for many, many years. So I go around the class, well, what brought you here? And there are these wonderful visions of healing the world, one touch at a time, one person at a time. So there's that compassion, deep, deep compassion that massage therapists have. And that can create a little bit of a conflict in then reporting someone. And I don't know that we emphasize enough that this is something far bigger than ourselves, that this could be saving thousands, if not 10,000s of other people having the same experience. And of course, I wasn't born. This would have been my older brother. But had it have been today with some other relative, I certainly would have encouraged that person to report the physician, because the child could have been saved and was left to die, essentially. I honestly haven't thought about it for a few decades, but it speaks to this point very vibrantly.
Yeah. I think the piece that is driven home to me is that that it's not vengeance if you're not tied to the result. When I think of reporting someone for doing something wrong, you do your job by doing the reporting. And then you let that board, you let that licensing board, you let that certificate body, you let them deal with all the research that they have to do with the discussion. And I don't need to know if they got shut down. I don't need to know if their license was pulled. That's not my thing. That is the job of that body, to make sure that the public is safe from that individual. My responsibility is to make sure that the situation that I went through is denoted and assessed so that there can be improvement. It's hard, especially when you look at how massage therapy can go wrong, how people can do things that are wrong, how people can do things that just don't support the profession. And then you go into the second stage where it's not just about, are they saying it wrong? Are they doing it right? But is the perception of what they're doing the true depth of what's going on? Is it more than just, did they do it right or do it wrong? did they communicate appropriately so that the person who they're working on understands what their purpose was? I'm in a minority in this profession. I think that's the only place I'm in a minority, but I'm in a minority in this profession as 19% or 21% of massage therapists are male. And the thing that drives me insane is the majority of lawsuits in our profession are against male massage therapists. So the minority in the profession get the majority of the lawsuits. And so my real push, and I've had this on my heart for years, is to connect with male massage therapists and say, what is it that's making you a liability? What are the things that you're doing or not doing that should be addressed so that the profession doesn't have you as a liability or as a person who has to be taken out of it because of something that you forgot to do, didn't do effectively. And the thing that I continue to draw back to is communication. That if male massage therapists communicated more effectively, they would be more likely to have people come to them and not assume that they meant something that they didn't, or that they were connected consciously enough to their actions that they were thinking of the end result before they got there. Those are two pieces. And when it comes down to me reporting another male massage therapist because of inappropriate behavior, I have not an ounce of a problem doing it. I'm not biased.
I think it's that communication affects us in so many different ways. Like, this is a country, to take a different example, of defensive medicine, in that physicians have to follow certain protocols, and the defensive medicine comes from not wanting to be sued. Mm-hmm. However, and this is my perspective, and maybe I'm in the minority in what I'm about to say, which is, if you are authentic with your client or patient, if you are honest, if you act with integrity, and you are open and you spend time, you have eye contact, you're truly listening at a deep level, then you don't have to practice defensive medicine. That kind of a physician isn't going to get sued. There's been some research that there are family physicians, internal medicine physicians, who have not actually taken an action as such. They didn't necessarily prescribe a drug, refer to a specialist, send for labs, and then compare that with the other person who does everything perfectly. They spent the full 7 to 11 minutes with the patient. They did the labs, they did the referral, they did everything. And when the patients were surveyed for satisfaction, is that first scenario that they said, oh, my doctor is so wonderful. And it was the listening. It was in one of the studies, it specifically asked patients, how many seconds they've measured, how many seconds does a patient need to articulate the reason they're there for the treatment? And it was 90 seconds. And at what point does a physician interrupt? And that's at less than 30 seconds. So they never fully articulated the 1.5 minutes of why they were there. And that escalated the sense of dissatisfaction. And it speaks to another version of communication. That person could easily go into a complaint from that level of dissatisfaction because of the constraints that we have in our whole healthcare system on time and money.
I've seen massage therapists who have a transference-based response in that same way, where they're a massage therapist and they know what they're doing, and so the client comes in, and so they're obviously going to tell the client what's going on, and they're transferring a doctor-patient relationship onto their client-therapist relationship, and it's not even a healthy doctor-patient relationship. And that's so scary to me to think of, okay, what model are you transferring? Because if you are looking at a healthy, open-minded, open ear relationship, or countertransferring. I guess it would be countertransference instead of transference. But you're building an open, positive communication. And doctors are looking at this and saying, you know what, it's not just can they talk, but it's can they talk and listen. For me, it's not how much you know, it's that you can put the knowledge that you have into application and make sure to engage those other people. When a client comes in and does an intake interview with me, it's asking questions to create that balance, but always let them bring the concern to you, express it. It's such a beautiful thing. And when you don't have that, you know, I hate to say it, and I hate to draw on the possibilities, but if we start looking at this concept and we say, okay, evidence such as firsthand knowledge indicating an unethical, incompetent, or illegal action, you know, incompetency has a whole different perspective. You can look at incompetence as someone who doesn't know how to communicate as a therapist, as a massage therapist. If they can't communicate what they're doing, is there some incompetence there? Yeah, there can be, especially if they're not safe about it. I got a massage, 2 weeks ago, and I went in for the session, and the client called me up. It was in the spa environment, and so they cold called your name and had you come back to the treatment room. You got in the room, and I don't know why they thought I wanted a deep tissue massage, but they had decided I wanted a deep tissue massage. And so as I'm laying there trying to relax, and I start feeling the elbows come in and start jabbing up and down on, oh, you got a big knot here. And I'm like, yeah, that's a bone. If you can back off on that, you don't have to go that deep. And every time I said, you don't have to go that deep, she'd back off for probably a minute and then dig deeper and then start trying to grind stuff out. And I'm like, I don't need things ground out. I just need to relax. So if you want to pull that tissue instead of jab your elbow into it, I'd be fine with that. It took most of the session for her to finally go, oh, so you don't want a deep tissue massage? No, I want to relax. I want the muscles to relax. And so for the last 10 minutes of the massage, I had a more relaxing massage that I actually enjoyed. To me, it was a success because she finally figured it out. And it was a success because when I told her, you know, I'm kind of a massage therapy educator. I understand where you're at. The importance in an intake interview is huge. If you think someone wants deep tissue, it's important to ask them to confirm that, because what you're looking at and what they're saying may be two different things. And checking in on pressure instead of having to have me tell you, that's another piece that's really, really quite important.
So I have almost the converse experience of that. Many years ago, I spent $200 on a 1-hour massage therapy session. I've never done that since then. But that's not the reason. It wasn't the money. It was actually the experience. So this person, the draping was a very small, what I would call a hand towel, actually. So they had the one hand towel for drape, and I'm not too tall, but not everything was covered. So I remained quite not at ease the entire time. And I knew that I actually did want deep work because I'm used to deep work and mobilizing and stretching and neuromuscular, muscle energy, active resisted stretching and all that. So similarly, the person didn't ask me what I was there for and proceeded with this lemon oil, like a full body lemon oil. I mean, it smelled wonderful, but it was, my entire body was covered in lemon oil. I mean, I could have slid right off the table and out of the room. I was that oily and with little to no drape. And I have to say, I was much younger at the time and perhaps not so confident to address it in the moment, because I think I was just so, first of all, I was vulnerable because I had this hand towel over me. And secondly, the only thing I could actually say to her was, "Are you nationally certified?" And she said, "No." And then that was when I said, I think that we've done all that we can do here. I had explained that I had neck and upper back tension, that I'm like this at the computer, postural issues. I do not know what initiated the whole. I'm sure that was a fantastic treatment for a person who was looking for that, but not having had that experience before and not accepting it then, it has lingered in my mind. It was almost 20 years ago, and I still remember it as a learning tool for us to really clarify why is the person there. And sometimes they're just there to be heard. Yep. Sometimes we may be the only person caring for them in their entire life, and the touch is a mechanism of something that they need in their life at that time. We may not be aware of it fully. Absolutely. So there's so many aspects to discuss, Nathan.
Oh, yeah, and really, the intake interview is a several-hour discussion in and of itself. But I kind of wanted to go back to this last, or one of the further on pieces in here. Let me just kind of open it up here. Incompetent or illegal action. I want to kind of address illegal action here just a little bit, because when it really comes down to illegal action, there's a couple of things that come to mind for me. One is once again, go back into my history. Worked in a spa years ago. And I had a client who came in and she seemed uncomfortable. And so I said, "Is there anything wrong? If you want me to refer to another massage therapist, we can do that. But I'm here to help you." And she's like, no, it'll be fine. And so I gave her a massage. And at the end of the session, after I left and she got dressed, she came out and she says, "Nathan, I just need to let you know why you might have been picking up this vibe that I was uncomfortable." And she says, "The last male massage therapist I had, at the end of the session, he came and gave me a hug, and I was okay with that. But then he forced a kiss on me." And that really felt uncomfortable. And I never went back. And I've been traumatized from that in feeling comfortable with men. And she thanked me for being listening and connecting and holding my boundaries. And I think one little thing for me that is just such a huge piece that I think our profession needs to address is we have these videos of massage therapists demonstrating a technique. And as they're doing this effleurage stroke, their hands going this far underneath the sheet as they're doing this nice effleurage stroke. That's crossing a boundary. In my mind, the way that I connect this, that's crossing a boundary for that client. And that's a huge boundary to cross. To put my hand underneath someone's sheet is, to me, is a big no-no. And I've kind of presented this way as creating boundaries, and strong and tight boundaries, so that your clients can feel comfortable and can know that you're not going to cross those boundaries, is something that needs to be addressed. Now, when a client comes to you and says, "Hey, you know what? The last male massage therapist I had, or the last female massage therapist I had, sexually assaulted me," our responsibility is to make sure that that client has safe ability to pursue whatever they feel is wrong. That's how I take this, because that's, once again, not firsthand knowledge. That's secondhand knowledge. But to make sure that our profession is safe from that behavior, we need to, from everything I know, please correct me if you think different, we need to let them know, you know what, you're safe here. If you need support, if you need to call the police, then do. If you need to report it to their supervisor, then do. But it's important for me to feel like you have the boundaries and you have the support to make sure that you're safe in the profession of massage therapy, that you're going to come back to massage therapy instead of say, this one massage therapist has destroyed my experience with massage therapists completely. We have to stand up. We have to be responsible. And sometimes that's just communication.
And I'm sure that you will talk about the boundaries more so when you get to standard 5, because that's really the crux of boundaries, but it really relates to all the other standards of professionalism and ethics and all the standards of practice. I think we can also learn something from the clients who don't come back. You know, sometimes you mentioned that we don't, as far as I know, we don't actively get back in touch and say, is there something I did that wasn't satisfactory? Can I correct this in some way? And actually, it's not always something negative. It might just be that they wanted that one session, and we can also jump to conclusions.
Correct.
So I have, after many years of practice, then started to follow up with people that I only saw one time. And it could be any number of things. It can be schedule, it can be money. You know, often a person will say, I would love to come and see you every week, but it's just not something I can do right now. Meanwhile, we might be thinking we did something wrong. But similarly, we may have done something wrong that we can learn from those clients that we don't see. So it's another difficult area for us to be authentic about.
Large companies usually have a benefit of having a survey that goes out to customers who will come back, who won't come back, and be able to get that type of data. But really, every massage therapist can sign up for SurveyMonkey. Every massage therapist can sign up for these other groups and get those evaluations sent out via email and get some good feedback. You know, I really do appreciate you, Lena, for coming and joining me today. We've spoken over our hour, and I think we could speak for another hour. And
I think we can speak for another 10 hours because we covered about 20 topics that we addressed, but we didn't address them fully. These are really issues that go with us for the lifetime of our professional career, and we can only really strive to do our very best and learn as much as possible to gain that higher level of wisdom and insight with our clients.
And we're always learning, we're always growing. Please remember that you don't know everything. And as we remind ourselves that we have more to learn, we get that opportunity to see the next step. And so, Lena, thank you so very much. I'm going to give some closing credits here.
The hour has flown by. We hope you've enjoyed this discussion with Ethics Outside the Box. As you've seen, Nathan uses many second-hand stories of ethical situations. If you'd like to share your story or you have any questions, feel free to contact him and Nathan at educatedtouch.com. If you'd like to register for next week's live webinar, go to shop.educatedtouch.com. Under live webinars, you will see all upcoming webinars. If you have just watched this video and would like continuing education for home study, you can go to shop.educatedtouch.com under the home study options with the date or episode number to receive your exam. If you would please like this video and subscribe to our YouTube channel, we will keep you up to date on new videos. If you'd like to attend one of our live courses, you can find upcoming scheduled events at www.educatedtouch.com. Thank you for joining us today.